And how are the duty hours? Like as the name emergency medicine, so are the duties very hectic? How many duties per month?
Everybody is thinking that emergency medicine is a branch that everyone left, then the branch will be taken. It's not like that.
It's a common.
The has been completed.
And how are the academics in your department? How are the plan?
Curriculum is well planned. Clear-cut timelines have been clear-cutly defined. So we can go, we can see if anybody is delineating from the curriculum, we can go and ask us. Secondly, acutely ill patients.
Acutely.
So for acute ill patients, your mind has to work, your decision has to be rapid because the life and death will be like instant.
Yeah.
If your decision-making capacity is last, then you are not going to manage the patient. You are not going to save the patient. The same. If you work more, you will learn more. You will learn more. Your confidence will increase. If your confidence is weak, you can work in any circumstance.
Environment. So how casualty and EMD are different?
We know the concept that sickest patients will be treated by competent good earning branch in America, one of the best branches, one of the most important branches, emergency medicine.
Hi, welcome to Small Dialogues. Today we have Dr. Rahul Rohan. He is my colleague, and he did his emergency medicine residency from NIMS, and he is currently working as assistant professor in NIMS. Welcome, Dr. Rahul Rohan.
Thank you, sir. Thank you so much, and thank you, sir, for giving me such a wonderful opportunity to engage with your audience. And I congratulate for you for conducting this vlogs for Usmania vlogs and doing this such a wonderful workup, sir. So myself, as sir told, I'm like will introduce myself once again. I'm Rahul Rohan. I completed my MD Emergency Medicine from NIMS Institute of Medical Sciences. I'm the first batch student of NIMS, and I'm the first government Telangana PG of emergency medicine. And I completed here MD Emergency Medicine and moved to AIMS. I completed 3 years of senior residency at AIMS. Later on, I moved back to the same place where I worked in PG, and now I'm working as an assistant professor. I completed my 1 year of assistant professorship. Now currently I'm in the 2nd year of master professor. Okay, sir.
I think you will be the right person to describe or else to mention about the depths of emergency medicine and its future for our NEET aspirants.
Yes, sir, definitely. This emergency medicine, everybody knows it's a fresh branch, and some people till also they will say that it's a new branch. We'll discuss in this podcast about in this series about what is actually emergency medicine, as you told me before. So we'll see, sir. I mean, like how it goes. Chalo.
Okay. So when do you came across this department, like in your UG or during your preparation? Like there's a branch called emergency medicine, and what factors help you to pick the branch?
Sir, frankly speaking, actually, because this is like engaging with the students, right? So whatever I have faced, I will tell. This is completely truths.
Okay.
Completely truth.
Okay.
So the thing, when I completed my this UG, and I don't know emergency medicine when I was UG, there is no doubt about that. And after that, when I prepared for my entrance examination, like my friend who is my colleague, actually now is my well-wisher also.
Okay.
He actually took the MD emergency medicine.
Okay.
I doesn't know anything about the emergency medicine. So once I finished my NEET, I finished the NEET, when I got the rank, and he told that I had an opportunity to take general medicine. I had an opportunity to take even pediatrics also. Not pediatrics, general medicine,
Okay.
but not general medicine in government. It's a private. Yes, I have an opportunity to do general medicine and all. But my friend actually, who is actually my well-wisher, I told you, he guided me. Because why he guided me? Because he was with me all the time, as I told. So he knows about me actually.
Okay.
So he knows my qualities and all.
Okay.
So he guided me that there is a branch called this. So I think you are the perfect candidate to fit for this branch. Okay. He told. Then I told him that I don't know anything about this. Why you are telling me all these things? And so, but he told me that you are the perfect person. So at that point of time, then when I was with him like for 15 days and all, I'm not into the department and all, but I traveled with him for 15 days. He told what is the pros, what is the cons, and as well as what is the emergency medicine and everything. After that, I understood that yes, for me, I think this is going to be the perfect branch, and it is fitting me for my my qualities and all. So there I come to the conclusion that yes, I need this branch. I need to take this branch. So that's how actually I took the emergency medicine. It's actually took me for 15 to 20 days. This is the only time where I have learned, and as well as I took, and the decision is happened within 15 days. 15 days. That's it, sir.
So now you feel very happy for that.
No doubt about it, sir. I'm very much happy, and I think whatever at the point of time I was initial few days, definitely there will be a problem with every branch. So to adjust, yes. So I used to surpass him like anything. My well-wisher who I told. So, but now I am telling you, because of him, I'm very much happy, and I say that I'm saying that I'm completely happy, and whatever the thing I have chosen, and whatever the thing I have went through all these things, So I'm completely happy by choosing this branch, sir. No doubt about it.
Very nice, very nice.
Thank you, sir.
And how is like how many PG seats are there now in NIMS?
In NIMS, sir.
Yeah.
Then in NIMS, actually, I told you I'm the first batch student. So NIMS actually two seats per year actually.
Okay.
So last year only, and it increased it from 2 to the 6 actually.
6.
So now 6 seats. So all India quota, we know that everybody from different states they are coming and they are taking. From Kerala, their West Bengal is there, and yes, from north and south everywhere, from Andhra Pradesh and everywhere like that.
I think the rank like yeah.
Sir,
What is
ranks, everybody thinks actually this is
Ah.
actually good question, sir, because everybody, even recently also, I mean like 2 days back, during our working hours and all, we have this, I mean like because the PG NEET has been completed, so they are coming, students are coming and they are visiting the department and they are asking for, sir, how is the department and all. Actually, that is a wonderful thing, no, sir, coming to the department and
Yeah,
asking.
true.
Yeah. So I mean like they came and they are asking to the department, asking about the department, how it runs and all. Just I asked them what is the rank. See, I mean, like they are telling that the rank is less than 2000.
Okay.
Okay, I will not telling exactly rank and all. Even this time and before time also, it is almost around the 2000. So everybody is thinking that emergency medicine is a branch that everyone left, then the branch will be taken. It's not like that.
It's a
The
common.
trend has been completely changed.
Okay.
Maybe initial part of the things, at least for 1 to 2 years, it has been there, but now it is not there. Everybody is fighting for the emergency department. There is no doubt about it.
Okay, so it's a good thing for the branch. Like it shows the growth potential of the branch, and so meritorious students are picking up the branch.
Yes, sir.
So itself is a good, great going for the branch.
Yes, sir. I am very happy that students actually who are meritorious, as you said, they are thinking how the thinking is there. That's why I think you'll say it's the meritorious students, right?
Yeah.
So that's the thing actually. So they are thinking, and the thinking part, that stance is changed completely.
Okay.
So they know that what they want. So they're thinking and they're taking, even if the rank is good, they want actually whatever they want. So that's it.
Oh, very good. And how are the academics in your department? How are they planned?
Sir, academics, frankly speaking, there is a clearer guidelines. NMC has released the guidelines.
Okay.
2024, the guidelines. I mean, like initially it was DNB. When DNB emergency medicine is there, they has a clear-cut protocol.
Yeah.
For about how much is the theory classes, how much is the seminars, how much is the journal clubs and everything. But NMC has clear-cutly mentioned how much. I mean, like how many classes per week, how many journal clubs per week, how many rotations per month. I mean, like everything. It has been clear-cutly mentioned in the NMC.
So you
as you are asking,
follow?
yes, definitely strictly follow the guidelines given by the protocol given by the NMC.
So
roughly you are asking, no, sir, because of that I'm telling that definitely there will be 2 classes per week.
Okay.
And as well as there will be journal club in a month.
Wow.
And as well as there will be simulation skill session will be there every 45 days. So it's like we follow the same protocol of the NMC. If anybody wants, they can go just type the MD emergency medicine curriculum NMC. They will get a first website, whatever they will receive, they will receive completely protocol. Even for the rotations also, 1 year rotation.
Peripheral
rotations, sir. 1 year periphery rotations will be there. It depends upon the institute basically. In NIMS, there will be 1 year peripheral rotations, sir.
What all branches you have?
Sir, all branches. Emergency medicine, it includes all branches. It depends upon actually which branches you are not having in your institute. It depends upon that. If you ask me, I can say that I went to the Osmania for this thing, pediatrics, Nilofar, and as well as ENT Koti I went, and as well as Gandhi obstetric department I went. So I mean, like for Dharma also I went. So it's like definitely how to go.
Your curriculum.
Even I am the first batch.
Even though you are first batch, you are exposed to not only your institute curriculum, but even if there is some if some departments are not there in institute, you are planned to visit and learn the skills like Nilofar, ENT, and Gynams. So the whole curriculum is well planned and well run.
Yes, sir. Curriculum is well planned. Clear-cut timelines have been clear-cutly defined. So we can go, we can see if anybody is delineating from that curriculum, we can go and ask also. There is no doubt about that.
Very good. Very good. And coming to thesis, when the thesis topic is allotted?
Sir, immediately when you join, sir, it is the same thing. It's not like that emergency medicine is some separate branch from everybody. In all the department, however, the general medicine, however, in the super specialty, everywhere, how the thesis will be allotted, the same will be the thesis. There is no differentiation from the other department. It is the same department, but everybody we knows that fresh thing, it will take time for to adjust.
Yeah.
So it will be very difficult to take. So that's the thing. Actually, everybody thinking that emergency medicine thesis and everything will not be there and all. It's not like that. Everything will be as per the protocol, as I said. The same thing. Whenever you join the department,
within 2-3 months,
within 2-3 months, your topic will be given, and you have to go through the stipulated time period and everything. You have to go through the protocol.
Okay, very good. And how are the duty hours? As the name suggests, emergency medicine. So are the duties very hectic? how many duties per month, like are night duties separate and day duties, how it is planned, because it's all emergency.
Yes, sir. Actually, sir, for that I have to, say something before that. We know that, frankly speaking, we know that, like in some of the branches, we will do 36 hours of duty, 48 hours of the duty. We know that. I don't want to say that which branches and all, everybody knows that. So, but emergency, as we are discussing about particularly about the emergencies, there has been a clear cut time period.
Okay.
Like 2 hours morning shifts, 2 hours. It's a shift wise duties.
Okay.
Why shift wise duties? Why it is important for the shift wise duties is because you are dealing with a critical ill area, not critical ill, acutely ill patients.
Acutely.
So for acute ill patients, your mind has to work, your decisions has to be rapid, because the life and death will be like in snap.
Yeah.
If your decision making capacity is lost, then you are not going to manage the patient.
Best.
You are not going to save the patient.
Yeah.
It's not about management also, it's not going to save the patient. So that's why there has been a clear cut defined this thing, working hours. So in 1 week you are going to work for 48 hours. So that 48 hours will be 2 mornings, 2 afternoons, and as well as 2 nights.
Okay.
So followed by the 2 hours. And it's not
2
like
hours.
that rule that if I'm saying that 2 mornings, 2 nights, and 2 hours, you have to go with your head of the departments and go for fight and it's like this is a protocolized. But the thing, you know that, sir, during the PG ship only, if you work hard, if you train hard, you learn more, because the time is very much less. In 3 years, if you work hard, you will learn more. If you learn more, you will earn more.
Yeah.
So this is the concept.
The more you learn, the more skilled you are.
Yes.
The earlier you can establish yourself individually.
Yes,
or you can work without any great support.
As you said, sir, same. If you work more, you will learn more. You will learn more. Your confidence will be in peaks. If your confidence is big, you can work in any circumstances.
Environment.
So that is actually the PG goal, right? You have to come out with the flying colors. Yeah. So that depends upon how you work.
Yeah. That's it. But as you said, duties are like shifts wise.
Yes, sir.
To morning, to afternoon, and to night.
Example I have given, sir. It depends upon how many PGs are there in the department.
Like rotations.
Rotations, it depends upon how many PGs are there. If 2 PGs are there, 2 mornings, 2 nights, it will not be possible, right?
Yeah.
So it will depend. It depends upon how. If it's a new branch for that institution.
Yeah.
So it depends upon how many patients are coming, how the branch is there, how the department is there, how many PGs are there, how many faculties are there. So it depends upon the number of the PGs and the number of the faculties, and depends upon that
hospital.
Institute.
Yeah. Yes. So all these factors weigh in.
Definitely, sir. Definitely.
Okay. And many people ask, already in many medical colleges there is a casualty already, which is dealt by most of interns or medicine PGs, or even some anesthesia PGs run up. So how casualty and EMD are different?
Sir, this is $1 million question. First thing, till if I go to any place, because I worked in a premier institutes, both NIMS and as well as AIMS. So till I go to any places like some medical colleges and as well as some of the hospital, still there are boards like casualty. And in some of the hospitals, sir, there is a casualty and there is emergency department also. Yes, it is there. Yes, it is there. Both the things are there. That means we only not know. Some of the people, it's not like that we means not all. Some of the people doesn't know what is the difference between casualty and as well as emergency. Sir, if you are okay, I will just go backwards because that is the most important thing. I think this is very much important for the every post aspirants, PG aspirants who are actually NEET aspirants who have done with their examination. Yeah. First thing actually, sir, how the concept came into the picture, how we adopted the system from America actually. How we adopted, I will tell. In 1960s and 1970s in America also, there is the same concept which we used to do. Sir, we know you worked as an intern, I worked as an intern. What is our duty as a casualty medical officer? We used to be posted there, and there is all specialties people will be coming helping us. So when the case receives, we used to call them, they will come and they will see the case. More or less is the same thing. So the same thing was there in the America also, the same thing. But what was happened is because they started analyzing the deaths. When they started analyzing the deaths in 1960s and 1970s, what happened is the death rate is more in the casualties. They understood that why actually the death rate is more even if all specialties are there. Is there a lack of any timely management or So they understood that yes, time is there, and as well as every specialty people are there. Then why the death is happening? They understood that we know the concept that sickest patient will be treated by competent person, right? Yeah. It should be. But what is happening? Sickest patient will be first seen by who? Interns. So it's not like an intern, sir. Because it's where we have posted many. Initially it was mainly where I can share my experience are many of
medicos experience in many medical colleges.
Yes.
I'm not like trying to blame anyone.
Yes.
The thing is like that because interns are initially addressing the case.
Yes.
Sometimes we may be posted for the first time internship in
Yes.
casualty also. Even we don't know about cannulation, all those things. So we may come across a cardiac arrest, or else a poisoning case, or a snake bite, anything we can come, else a RTA. So yeah, as you said, by the time we call, by the time the anesthetist or the neurosurgeon comes, it will be
Yes.
delayed, little delayed.
So basically, what was happening is it's like the same thing was happening in America also.
Yeah.
So they have done the studies. We know that they will do all these things. So they understood that the concept of this acute care they came into the picture. That means they understood this is happening because of a competent person is missing in the critical area, not critical area, sir, acute area.
Acute area.
Because critical means completely a different concept again. So the acute area. So in the first initial offers of acute area, the delay of the treatment is happening. It's not because of the unavailability of doctors. Doctors are available, but the first person who is seeing is not the properly trained person in the acute care.
Yeah, yeah.
So they came to the concept that so for this we have to develop a branch. So the person who is in the department, who is initially called the casualty should be an acutely trained, but the person should be a trained person in the acute care.
Acute care management.
Yeah. So they understood that. After that, what they have done is in 1980s, 1960s, 1970s, they started emergency medicine. And 1980s, they implemented the program. Now it is successfully running, and one of the good earning branch in emergency, good earning branch in America, medical branch. I mean to say, good earning branch in America, one of the best branches, one of the most important branches, emergency medicine. So that's how actually we adopted that system. It took us long time,
yeah.
But actually we are talking about MD and as well as DMB, no sir. Before that, actually there are many fellowship programs here. There are fellowship programs of emergency medicine. I don't need to, like, I'm not talking about much into that. But the thing is that some of the private medical colleges and as well as some of the government medical colleges, they run the program. I mean, like some separate autonomous institute, they run the program. They run the program of these fellowships. That is before only.
Okay.
Before the India has been recognized and everything. But now in the 2010, because of the importance of this all things, we know, sir, nowadays we are receiving that every 24 seconds, every 24 seconds, death is happening at the worldwide.
Yeah, yeah.
Road accidents. So I mean, like these things are very, very common. So first patient has to be seen by the best person.
Yeah, yeah.
So the concept came into the picture. Our NIMS also taken to the mind.
Consideration.
Yes, and after that, now in 2010, actually the concept of
emergency medicine
introduced, and MD emergency medicine has been recognized.
So
and after 3 years of this MD emergency medicine as an MD, then the DMB emergency medicine also has been recognized. So DNB. So MD 2010 and 2013 is the DNB.
The branch recognized by
NMC and NBA. So the only recognized branches in emergency medicine is MD and as well as DMB.
Okay. That's it.
Yes, sir.
Okay. Then if I can correlate all these things,
yes,
I feel that future, because as NMC and NB have recognized this branch, and there is more of utility of the branch in medical management. So I feel most medical colleges which are not running the departments in future will have these departments.
Definitely, sir.
To my knowledge, I can analyze it.
Yes.
So as sir, more branches come,
sir, I think your perspective is changing. Before talking to me, sir, perspective was come something, and when I'm talking to sir, perspective.
My perspective. No, because it's like learning through talks.
Actually, why this is happening, sir? Everybody, when they are going through the emergency department, they are just peeping out of their window, and they are just seeing the emergency department. Never entered into the room, and they are seeing what they are saying.
Yeah.
So that's the reason nobody knows. Yeah. Everybody knows, no, sir. Until you enter into the field, then only you knows what is the hardship and what is the small difficulties.
So the growth potential is too huge. So once the people who join now, they will be like in 3 years you will be board certified emergency medicine physicians.
Yes, sir.
So then they can go and start their departments in different medical, maybe private or government, and even in like they have a lot of growth potential. I can analyze.
Yes, sir. You mean to say there is a lot of vacancies, right?
Yeah.
Immediately passed out.
Because many branches will
many branches are saturated. Now you mean to say that immediately if you are passing out from the emergency medicine,
so
DMB emergency medicine, there is a lot of vacancies. It depends upon the person actually who has to take, whether he has to go with the academics into the institutions or into the medical colleges, or it depends upon where he wants to learn the private practice. So definitely there are opportunities. There is no doubt about that. Yes.
And are there any like critical care fellowships, like if anesthesia and even general medicine, they can go for critical care or it's cardiac like this? Are there any DM or super specialties attached to it?
Yes, sir. The DM is there. MD emergency medicine DM is there. Critical care is there.
So you can write
I
DM.
also actually, I mean, like, done with
You're-
yes. I've written super specialty. I also got the rank, but the thing is that I doesn't want to join in critical care. That's my decision. I
Okay.
wanted to continue in emergency medicine. I'm
Okay.
like in the emergency medicine only.
Okay.
So the only branch as of now which is for the DM is available is critical care only. But there has been some legal things are going on in the court and all regarding that, because it's a branch. So you know that, I mean, like, now critical care is not only the branch they wanted to opt as a DM. So they wanted to include some of the other super specialty things, DM branches. So that fight is legal fight is going on, but I think it will take time. But legal fight is there. But never know when
till
we will
now,
accept.
DM,
Till now, only one thing, that is a critical care. There is no doubt about it.
Okay. And like how is the work structure in corporates? Because corporates casualty, is it little like, I mean to say, emergency, is it little different? Do they have more anesthetists or else EMD physicians? Like, what is the corporate
So
work?
same thing, concept is same. As I told before, the concept from casualty to the emergency medicine. Nowadays you can see that initially we have never seen the boards like an emergency department.
Yeah.
In even emergency in corporates also. When we used to study, sir, we used to see the names of an hospital. That's it.
Yeah.
Now names of a hospital, along with that, first if you see the entrance, there will be emergency board.
Oh, okay.
These boards initially used to not there.
Not
Nowadays
there.
emergency in every private hospital also. Nowadays its emergency department is already there. It is established. Everybody is welcoming that department, and as well as they also understood the concept of this saving and everything. So emergency private is private also. They are established, running. Actually, I also worked in a private for 2 to 3 months, and because I got that opportunity to work here, that's why I came back to here as an assistant professor. So like this opportunity is there in the private also. There is no, I mean, like, exactly, I mean, like, as you say. And about the working hours, sir, as I told, working hours, it's like it depends upon the institute and it depends on hospital, and it depends upon the number of the residents. So outside, once you complete the MD emergency medicine, how the working hours, it depends upon the same thing.
Same.
How your number is there. So depending upon that, you have to go.
Yeah. So coming to, like, as it is emergency, so you what kind of insights or qualities does a aspirant need to have to take this branch? Like, which suits them better?
Acha, you mean to say, sir, I mean, like, who is the person actually
fit or more apt?
Yes. It's like, sir, okay, I will see if I start discussing about this, it will take time, but I will say there one of the 5 most qualities I will say. I cannot say all the qualities, but top most 5 qualities I can definitely say. Sir, emergency, as I discussed before also, it's a time first thing. So the person has to have a time management first thing. Matlab, time based. Time saves the life. Brain is a tissue, time is a tissue, and
everything is time dependent.
So time dependent. So time is the
quick actions, time.
Frankly speaking, actually everybody run with the time. Actually, emergency physician has to race with the time.
So we were like,
we will race with the time. So time management is the most important thing. Okay. The next thing will be team. Sir, team is the most important thing in case of an emergency department, emergency physician. He should be a team player.
So he should be coordination.
Definitely it should be a team player. As you know, you are the basketball player, so you are also a team player, right? So it should be a team player, definitely, because team management is the most important thing. So it is a time and as well as a team. And next thing will be like P and P, sir. It's like a pressure and as well as performance. Why I'm telling about the pressure means, every branch there will be pressure. Your branch also definitely will be there. There is no branch called such thing that, sir, I don't have a pressure. Nobody will tell that. Pressure, it is how we take. That depends upon us. So emergency physician, he has to work in a high pressure environments.
Yes.
So usually what happens when the pressure comes, definitely our mind body coordination will fail and our mind will not work. For me, it is completely somewhat different.
Okay.
Because I work like anything in high pressure environments. If my pressure builds up, my mind will sharpen like anything.
Focused.
I will be still more focused.
Okay.
So like, you have to be ready enough to have, you have to understand that there will be high pressure environment, and you have to be very sharp. So like that. And the performance, even if performance is like, it's not like that, sir, my duty is 12 hours, my duty is 48 hours, I'm not able to. So it depends upon like how your mentality, how your performance definitely matters in the emergency department. So team, as I discussed, time, as I discussed, pressure, as I like discussed, performance, and the main important quality is leadership.
Okay.
If you are a leader, because sir, what emergency department, everybody says, sir, it's a chaotic environment. If you come to the department, we can see that you listen for a lot of, even once you listen, try to listen something through the stethoscope, it's not possible to. So
Yeah.
it's like a very
Because
chaotic environment.
it's like that.
But everybody will call as a chaotic environment. What we will call, we'll call it as an organized chaos.
Organized chaos.
Yeah,
Okay.
for us it is an organized chaos because he will be maintained by the team leader.
Yeah.
That's why the leadership is most important.
Uh-huh.
So leadership qualities should be most important. One word you can say, he is the king of the duty ship. It should be like.
Okay.
And the next thing will be coordination. Every branch should have a coordination, and here it is
interdepartmental coordinations.
Interdepartment with the sister, with everybody's coordination is the most important thing with the patients and everybody, because I discussed high pressure, life and deaths are the ones which we deal in and out a day.
Yeah.
So coordination with everybody is so much important.
Then
So
only you
these
can
are
give the best.
Yes, sir, definitely. So team, time, pressure and the performance, leadership, and as well as coordination. These are the at least 5 qualities
Person should have.
But it's not possible to have everybody to have these 5
All
qualities.
this.
Sir, I have 5 qualities, I will come and I will join. It's not like that, sir. But these things they will learn. These leadership
with time,
qualities,
they also
with time, at least if I have 1 to 2 mindsets, sir, so they can come and they can join. But these things are the important things. During the post-graduation ship, definitely they will go through
Learn.
all this phase.
Yeah.
They will definitely learn. I am guaranteed for that.
And very good of that. And coming to what all works like emergency you do, intubations, and because they want to know like is it like CPRs, intubations, adrenaline drugs, all these things. What all, like just a brief note.
Sir, everybody thinks that emergency medicine is nothing but intubation, central line,
Okay.
and CPR.
Okay.
That's the thing. That's the concept. I'm telling the same thing. Everybody is just seeing through the window and judging somebody.
Yeah.
Nobody is entered into the room. Actually, what they are doing.
Yeah.
So once they come into the field, then only knows actually what is the battle.
Yeah.
They are not coming to the battle just seeing
Outside.
Yeah, and they're telling that he is like that, he is like that, he is doing like that.
Yeah.
It's not like. So basically, sir, as you said, I will say one thing. Emergency medicine they consider as a jack of all trades.
Okay.
Like from head to toe, pediatrics, cardiology, everything, critical care, everything. You have to know everything about each and everything.
Yeah.
It is considered jack of all trades, and some of the people actually last time also when I discussed with my friends only, they are saying, "Are you are jack of all trades, but you are master of none." They'll say that the thing simply, master of none. Sir, everybody has a boundaries.
Yeah,
Your branch has a boundaries. Our branch has a boundary. Every branch has a boundaries.
Yeah.
Like that, my branch has a boundary.
Yeah,
we definitely not deal with the definitive surgeries. We definitely not deal with the long-term treatment, long-term management of the diseases.
Yeah.
So that is my boundary. So I am not going through the boundary. I don't.
Lines are drawn.
So the boundaries are there. So the thing is, what I mean to say is that we are not masters of that thing, definitive surgeries and everything, but we are masters of first hour. The first hour acutely ill hour.
Yeah.
If first hour is managed, then next hours will be there for him.
At least.
Otherwise, nothing is there.
Yeah.
So we are masters of resuscitation. As you said, CPR and everything, it's a part. That's it.
Yeah.
We are masters of stabilization. We are masters of triaging, sir. If the patient is not triaging, then the patient will not able to do anything. Sir. We are masters of coordination. We are masters of trauma management. We are masters of dealing with high pressure environments. So everybody has some mastery in them.
Yeah.
It's about how you know, how you choose, how you identify yourself. So we are not masters of the long-term management of the patients. We are not masters of the definitive surgeries.
But you have.
So we are masters of our role.
Yeah.
Our role. If you ask me, sir, I did from head to toe, you have to know everything. It's not like that the patient will come with a chest pain only. And there is a phobia, actually. I want to convey that also to the audience. That everybody says that, like chest pain, MI, and stroke, and these are the only things actually people deal with in emergency department. If you just go through the websites, WHO and as well as our Indian websites, just they will say that, like what are the most 10 causes of deaths. So these are the first things.
Yeah,
that's why you think that these are the most common, but you don't think that these are the only
things. Yeah.
So we deal with all the other things also. It's not like that. I'm telling from head to toe, you have to be ready for everything. If you ask me, I did ED thoracotomy. I cannot say because ED thoracotomy is a teamwork. So we did ED thoracotomy. I don't remember how many pericardial synthesis we have done.
Okay.
I don't remember any. Like this number is too many. Even the tracheostomies, everything, sir. Yeah. Cannot say like that. I have done this many, and everything. So even pre-episode management, everything you have to aspirate. You have to be ready for the that. You have to ready for the this thing
situations.
Ready for the situations. So that's what I
and
said.
Deliver.
That's it.
And give
identify, deliver.
That's it.
That's your job is done. Next, long-term management will done by the
Other
other people.
specific branch.
So it is considered as a jack of all trades, master of the none. As I told, why is the thing, and now nobody should say that master of none. We are the masters of the whatever I discussed.
Yeah, everyone is masters in
So
their own realm.
yeah, everybody is masters in that. There is a boundaries for everything.
Yeah.
So the boundaries has to be. We have to know about what is our boundaries and all.
Yeah.
So this is the scope. And as you said, it's not about the intubation and everything. It's about A to Z from the head to toe.
Very good. And coming to the scope, like once you pass from an institute, what is the scope outside and what are the payments?
What are the payments? So payments, I mean, like as is discussed, it's a fresh branch.
Yeah.
There are a lot of vacancies.
Okay.
There is no doubt about that. Whoever they are coming now, medical colleges, every medical college they are opening the emergency department. So there is a
Recruitment.
deficit faculty is there first of all.
Because less seats.
So
more
the
vacancies.
faculties everywhere you have a faculties posts are there. Even recently also aims, I mean, like different aims, peripheries aims, the vacancies are there. At the same time, in private hospital also there is a lot of vacancies. So there is job vacancies are very much high, huge, and the number are very much less.
Yeah, people are less.
People are less. So job opportunities, there is no doubt you have a very good number of job opportunities. There is no doubt about that. About the salaries, compared to the, I cannot say this is the amount of the salary you are getting this much. So you are decent enough to earn much, and compared to the all other branches, you are very good at site. As of now, you are earning a very good number. Why? Because all the other branches are saturated. This branch is not saturated. Everybody wants the person who has to manage the emergencies. So you are having, I mean, like you will get a good number of salary, and it depends good amount of the salary. And as your experience increases, definitely it will go up to the 4 to 5 also. But after that, I mean, like I cannot say 5. It depends upon how and where you are working.
Yeah.
And after that, it depends upon how you are dealing with the things. So I can say the one thing, sir. I mean, like because this is for the students of who are completed the NEET aspirants who completed, where actually they has to take this thing. Yeah. Actually, where. So that is the most important thing in India. Actually, it is like in 150 medical college, 150 centers, 450 seats are there. MD seats.
Okay. 450 seats are
450
there in
seats in
150?
150 colleges. 150 colleges, 450 seats. And in case of a DMB, this is MD only. DMB 129, 130 most probably. I mean, like exact number 1 to 2 years will be there. 130 colleges. It's like 250 numbers. So almost
600, 650 seats are there.
So I will compare just. So this is a branch with 750 seats, 750 to 800 seats, and other branches are running with the 6,000, 7,000, 8,000. There is no, I think data is there in NIMS. I am not just bluffing. Everything is there in NIMS. So you think job opportunities definitely will be there. There is no doubt about that. Even the salary also, because you are the only person who is right now hot cake like anything, you are ready. So it depends upon how. That's why I'm saying working in the department is very much important. First 6 months they will know that how you are working. So it's your salary also depend upon, if you are working in private, it depends upon how you are working. Performance, there is no doubt. And at the same time, where you have to take, that is most actually.
I want to ask, because there may be many departments, but some institute may have very good curriculum, good load of patients, good exposure. Some may not be. Do you have any suggestions to checklist, like if a center offers these things, you go there like that?
So definitely, sir, I can definitely say I want to say this. This is the most important thing in the whole this, I mean, like our this thing. First thing is, whenever we are going to this, so to see the institute or any college or any institute, first thing, please see, first and most important thing, workforce. Workforce includes faculty and as well as colleagues. In the faculty, if you want me exactly to into deep, if you want to say, please look that any MD faculty, MD emergency medicine faculty is there or not. If it is there, if he is there or she is there, that means I think it is one of the best, and as well as it is very good for your future. So workforce is very much important. Faculty and as well as the number of residents also. That is the most important thing. Next thing is make sure that, I mean, like as I said, the number. Why the number important is because usually pressure environments and everything will be there. So you have to be ready for that. So how is the load of the patients?
Patient
load of the patients. I definitely say if the load of the patient is more, then it is very much important, right? If
So
the
any
load is
number,
more,
any number.
sir, I cannot say like
Say
that
number,
number. It
but-
depends upon the state, right?
Yeah.
When you are working in some premier institutes, one of the premier institutes get per day 400 patients.
Yeah.
Like one of the premier institutes will get 100 patients per day. One gets 70 patients per day. It makes sure it depends upon how actually where the hospital is there. So makes it, because I know that the people that are working in some of the places where the per day is also 10 patients. I don't think so. It is a place to work.
So at least 50 to 100 patients per day.
So I cannot guarantee 50 to 100 patients. I'm telling.
I mean, is it a good
yes,
place?
definitely, sir. Definitely, 50 to 100 is not a small thing to visit emergency.
Yeah.
Emergency 50 to 100 is a very huge
Good,
number actually to say.
So I mean to this.
Yeah. To want an approximate number, yeah, definitely, there is no doubt. Yeah. So this workforce, as I discussed, and as well as about the load. And the next thing is infrastructure. If you have everything but you don't have infrastructure, I think when you are coming, as the sir said, private hospital, how it is there. Private hospital, they will assess for your skills. If you doesn't know how to do, I mean, like for example, like a POCUS, I mean, like I'm telling like an example, like a POCUS, point of care ultrasound. So make sure that whenever you are going to the department, whether it is completely equipped or not. Because nowadays everything running to AI and everything, no, sir. Before that only we know everything. But before that only we have a lot of equipments. Equipments plays an important role because point of care tests, all these things. So whether these are available or not. Some of the places there is no ABG machines also. Yes, there are places, sir. Definitely there are places.
It's a difficult
so
place.
it is difficult. There are places. There are people are there like that, but still they wanted to do and all. So make sure that infrastructure is available.
Yeah.
So it's like first thing, team workforce. I mean, like workforce. Next thing is patient load. And the next thing is infrastructure. So these are the main three qualities. If these things are there, then you will be able to manage everything.
Yeah.
Why? Because if your colleagues,
all
if your colleagues are good, automatically your pressure environment will be come down. Your burnouts will be very less.
Yeah, that too important.
Yeah. So these are the things will come into the
picture.
Play important role.
So how would be the work-life balance? Because people nowadays are worried about if more initially they used to take challenging branches. Also nowadays people are considering, is the work-life balance maintained? So what are your inputs?
So work-life balance, it definitely, as you said, initially everybody used to work like a very long hours and all, but nowadays nobody wants to work in a long hours.
Yeah.
Because they have a family and all. That is the most important thing. Yes, the family is the first always. Work-life balance, it depends upon your mindset, how you are choosing. Suppose you are going to the institutes. The jobs will be like an assistant professor. So your job will be like 8 to 4 duties. So it depends upon that. And if you are going to the privates, as I said, it depends upon the number. Mostly in privates, actually the night duties will be there, not only for the emergency, for everybody. Night duties will
everybody. Departments have.
So work-life balance will be same like the thing actually happening to
other
others.
departments.
There is no doubt about that. And about the year, for the students there will be two mornings, 2 evenings, and as well as the 2 nights, because that is the PG post-graduation ship. They has to work like that. Work hours should be 48 hours. They have to work like that. Work-life balance is good. The most important thing is during the PG ship, definitely there will be shifting hours. Post that, shift hours will be there. Post that, how do you choose? Depends upon us. Sir, I like only family.
Choice.
Yeah, I like only family. Then you go to the institutes. I want a family and I want like money more and something. It depends, like your mindset.
How you want to play with your
how do you want to play with your life? It is your choice. We have a clear-cut options. And last one more thing. I mean, like as you asked, sir, regarding scope. Not only here, sir. If you want to critical care, I told. Other than that, if you want to go to, because some of the people actually nowadays, future generation, everybody wants to go to the other states, other countries. That is, emergency medicine is one of the beautiful branch in Middle East countries. Very much pay, very much
high
good
pay.
salary. Good salary is there. Why good salary is? Because emergency medicine is there itself before only. But the thing is that the number of PGs are less. Number of students are less. That's the reason still there are vacancies. Now you can go and check the websites of Middle East countries also. We can able to clearly see how many number of vacancies are there. Not vacancies, sir. You can say that how many number of doctors are there in emergency department. You can compare that.
Just compare how many.
You can compare. That's the reason actually they are offering more. So that, and if you want to learn in the UK, you can go with a degree of an MRCM. MRCM you can do, and you can go even Australia also. So these are the branches which we can go from
directly. They consider our post graduation.
Not the post graduation will not be considered, sir. In UK they will not consider our post graduation. You have to write an MRCM for that. And for Dubai, if you want to go to the Middle East countries, yes, MD is recognizable. MD. You have to write their entry
Just
examination,
entry exam.
entrance exam, and they will definitely they will have an interview, and post that you can work there. So MD.
It's a good thing.
Yeah.
So overall, what do you want to give a message, a brief message to our audience, like about your branch and our institute?
Sir, we have discussed all this time, and sir wants to give me one sentence. I already told sir that if I talk about my branch, because I'm very much emotional when I'm talking about my branch. Why? Because I have faced a lot of things. I mean, like everybody is coming and saying this, you are not doing. I mean, like you people have to do this only. Why this is happening is because all the people who are working in the emergency department are from the different branches, like the faculties. I mean to say,
Yeah.
they posted in different from the different branches to the this department. So what is happening? As I discussed, coordinations. The coordination, sir, in the same branch, same department is very much difficult to have a coordination. So you are expecting that from all other departments to have a very big coordination to form a new department. That so it will take. It is not possible. That's why what they are doing, sir, they are making other students to go to the peripheries, go to the nephrology, go to the neurology, go to the other branches, so that you are done, your degree is done, and they are happy. This is also happening actually. So these things are there. So make sure, first thing, as I discussed, if you are willing to take about the emergency medicine department, please think about what qualities you have, and think about, as I discussed, the work-life balance. Think about the workforce, and think about the time. I mean, like infrastructures and everything. Now I discussed, because I am the person who is almost got experience with 99 years of experience in MD emergency medicine. So with all this my experience, if I start talking, it will take 2 hours or 3 hours also. But I'm just keeping everything in simple. It's not like that these are the only qualities. I'm keeping it very simple, so that everybody will understand. It should not be a very lengthy video. So it should be a very short and sweet, and as well as simple. So these are the things. Keep in mind. Don't take the branch if you doesn't know about. I mean, like if you doesn't know what is it about. Please go to visit, and understand, inquire, see, because that is the most important thing. Is these 3 years will makes our next future of 60 to whatever the remaining years,
60 years.
60 years. So please, I want to say that please choose wisely. That is the most important thing. And if anybody wants to choose an emergency department, choose wisely, and definitely it is a good branch. There is no doubt about that. Okay, sir.
Thank you very much. Thank you very much.
Thank you, sir. Thank you so much. And it's like
it was a very good talk. We got to know many insights about emergency medicine. Even as a person who have been in he's like nearby him, but still because of this talk, I came to know many things. Thank you very much. I hope this video has helped you a lot. Please do like, share, and subscribe. For more videos, please comment which video you want. Thank you very much.
Thank you. Thank you.